As the world has become more and more evolved, it follows that its healthcare has evolved as well. Gone are the days where you ask a plague doctor for help and have him bloodlet you. Now we know why we were getting sick and how to take steps in order to fix that. Despite the fact that the healthcare system has improved so much since the old days, there are still issues with how healthcare is being given. The price of healthcare has been rising consistently throughout these years. It has been hard for people to get affordable healthcare for their budget, especially in marginalized communities. This can be due to a variety of factors, including social, economical, environmental, and structural differences. These communities include, but are not limited to, the LGBTQ+, women, and blacks.
The largest component of higher U.S. medical spending is the cost of healthcare administration. About 1/3 of healthcare dollars spent in the United States pays for administration, while Canada spends a fraction of what we do. Whole occupations exist in U.S. medical care that are found nowhere else in the world, from medical record coding to claim submission specialists. Greed is the second part of excessive health spending. The U.S. list price for insulin is 10 times higher than that in Canada. But pharmaceuticals are not the whole story. Prestigious hospitals charge multiple times what less prestigious hospitals do for the same service. While that may be justified in the case of complex surgery, it surely is not for an x-ray.
$80. $600.
$250.
More.
Shut the fridge.
More.
£300.
Double it.
$600.
High cost is the primary reason that prevents Americans from accessing healthcare services. Americans with below average incomes are much more affected, since visiting a physician when sick, getting a recommended test, or follow-up care has become unaffordable. The cost of new technologies and prescription drugs has risen. The availability of more expensive, state-of-the-art medical technologies and prescription drugs generate demand for more intense, costly services even if they are not necessarily cost-effective. Nationally, chronic illnesses contribute huge proportions to healthcare costs, particularly during end-of-life care. For example, patients with chronic illnesses spend 32% total Medicare spending, much of it going towards physician and hospital fees associated with repeated hospitalizations.
$200? $2,500.
The LGBTQ+ community has overcome a lot of hate and discrimination already, but there still remain many health inequalities among the community. Research shows that people who are a part of the LGBTQ+ community have worse health outcomes when compared to people who are cisgender or heterosexual. LGBTQ+ patients often report a variety of ways that they have experienced discrimination within healthcare, some of those being denied fertility treatment, counseling, routine screenings, and even pediatric care for their children. A study that was published by the Center of American Progress in 2020 showed that 15% of LGBTQ+ respondents reported postponing or even avoiding medical treatment altogether due to fear of discrimination. This is especially concerning when we take a look at the discrimination that the transgender community faces. Not only does the transgender community face discrimination and often get turned away from healthcare because of it, but many physicians are not adequately trained on how to provide proper care to transgender patients. There needs to be sufficient training in healthcare issues that are unique to transgender patients, such as hormone therapy, sex reassignment surgery, and transition care.
99% of the time when I go to the doctor, I'm anxious and nervous.
Even though insurance and driver's license and everything says female, you really don't know what to expect.
Yeah, I don't think I know any trans person that went through the medical system and had a nice time with it. Not in this country.
Discrimination, stigma, bias, and systemic inequalities combine to hinder the LGBTQ+ community from receiving the proper health care that everyone deserves. Educating people and spreading awareness about these issues can help make healthcare more equitable and inclusive for all.
Almost a year.
7 years.
8 months.
I went 16 years before I was properly diagnosed.
I went 10 years in pain before I was diagnosed.
Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane, quoted by Martin Luther King Jr.
I was told that I was a female who was looking for attention and that they see no sign of anything else wrong with me except for maybe it was in my head.
I was told that I was crazy.
According to Amy Crockett, Black women have a higher incidence of breast, endometrial, and cervical cancer, and lower survival rates after diagnoses are made. Black women experience higher rates of unintended pregnancy, and during pregnancy, higher rates of maternal mortality and preterm birth. Dr. Brewer says that 1 in every 2 black women over the age of 20 in the U.S. have some type of form of heart disease. Many are shocked and surprised of the disparity between a man and a woman. As a woman, listen to your own body and be your own advocate. Don't wait until it's too late. Get the help you need.
The most disrespected person in America is the black woman. The most unprotected person in America is the black woman. The most neglected person in America is the black woman.
African Americans make up about 13.4% of the U.S. population, yet they are the most economically deprived demographics in the country. In the 50s, they didn't have many choices as far as healthcare. It wasn't as accessible as it was for others due to distance and affordability.
The healthcare system then was limited. It was not good for us. And medicine costing so much that my family says sometimes, will I eat or will I pay for my medicine?
Historically, black people have been disadvantaged in this society, making them more vulnerable to stresses that come from the environment, health education, insurance, and access to healthy foods. About 4 in 5 African American women are overweight or obese. They have the greatest prevalence of high blood pressure in the world. Of the 1.6 million homeless people in the US, 50% are black. The best solutions cannot just be medical, but also systemic. Because of the historical structured racist practices and institutions from white majority policymakers, administrators, educators, and healthcare providers, racism may be the most important phenomenon underlying black health disparities.
They told us we had to raise $500,000, but we couldn't even raise $10,000. Sarah died. She was 25. We all die. But tens of thousands of Americans die too soon. And the killer is not random. This killer strikes particular people in particular American neighborhoods. This killer is inequality.
For how easily people get hurt, it is incredibly hard for people to get access to affordable healthcare, especially in marginalized communities. This includes groups such as women, LGBTQ+, and races such as the black race.
In a society such as this one, health disparities must be counteracted by equally systemic measures through social programs, economic investment, criminal system reform, decreased segregation in positions of institutional power, more inclusive research, and appropriate funding of public agencies and healthcare institutions.
Prevention or changing adherence is not going to be a one-time activity. It's something that's going to have to occur in an ongoing and sustained fashion.
Again, we're talking about this multi-level necessity if we're going to end this epidemic now.
It's not a day, it should be a movement. And until we have that movement, we're not going to be doing the work that I think we need to be doing.
In order to have a strong nation, we must keep our people's mind and body happy. Because it is health that is real wealth.